Good morning, happy Friday, shiny people. I wanted to pop by and do a quick video about high blood pressure. It's something I get asked about a lot, and it's something I have professional and personal experience with. So I just kind of wanted to share a couple of things that helped me along the way into understanding blood pressure and how it contributes to your overall health level. So high blood pressure is basically a consistent reading of blood pressure that is over 120/80. There are very specific guidelines as to phase 1 hypertension, phase 2, and so on and so forth. But for the purpose of this video, just to kind of give a little recap, anything over 120/80 as a consistent reading is considered hypertension or high blood pressure, and 120/80 is considered normal if there is such a thing, and then lower is lower. So there's issues with blood pressure as far as if it's too low and if it's too high, but usually what we consider the most dangerous effect on health is what is chronic hypertension or high blood pressure. So it's a little bit misunderstood. I like to talk to people when they come to me and they say, I have high blood pressure. I say, let's rephrase that. Let's say my blood pressure reading is high sometimes, right? Because it's not like your blood pressure is just your blood pressure and that's what it is all the time. It changes minute by minute, every time you move, every time you shift. I mean, it's always changing, just like the pulse rate. So what we want to look for is a consistent reading that's high before we say it's any type of high blood pressure. So of course your doctor gives recommendations for that. So as an exercise physiologist, the understanding of how exercise affects the body and can over time work to lower blood pressure is where my concern comes in. So when I gave birth to my first child almost 18 years ago, I developed preeclampsia, which is a pregnancy-induced high blood pressure or hypertension. And it literally almost killed me. The complications in the birth and with everything that happened, that preeclampsia caused a very dangerous health complications during my first delivery. So after that, I started looking into ways that I could heal not only from carrying a lot of extra body weight, but also from high cholesterol, high blood pressure, possibly leading into some pre-diabetes, all of those issues that I was experiencing at a pretty young age, about 26. So when I came out of that delivery, the doctor prescribed a low-dose blood pressure medicine, and I was really resistant to taking it. I just felt like, well, it was a rabbit hole. I felt like I was going to take it and then I was going to have to take something else and so on and so forth. So I took it for a little while to get my blood pressure stable. And in the meantime, I started working on some lifestyle changes to kind of help it lower naturally. So the interesting thing is that when I started working in cardiac rehab, it kind of reaffirmed a lot of things that I had been learning. And that was that we saw people with high blood pressure and the resulting cardiac events from all walks of life. So we had male and female, we had smokers and non-smokers, we had drinkers and non-drinkers, we had people who were overweight and people who were not overweight. So the common denominator between all of these people who seem to share this diagnosis, if you will, of high blood pressure was a high stress lifestyle. So a high stress lifestyle really does put a lot of pressure on the body systemically. More specifically, if we talk about blood pressure, we know that the top number, your systolic pressure, is a reading that indicates the force of the blood pushing against your arterial walls as the ventricles kind of contract and pump to move blood to the body. And the bottom number, the diastolic blood pressure, is the reading or the number that indicates the force or the pressure of your blood against the arterial walls when the ventricles are kind of relaxed and waiting to be refilled. And it's not like it's a long time. If you think of the pulse, don't, it's all happening very fast. But that blood pressure reading that we get, that's actually what it's measuring. So any extra strain or inflammation in the body is going to be a contributing factor to high blood pressure. Lots of carrying extra fluid in the cells and a lot of extra body water. Also, one of the major causes of high blood pressure, and that's why if you have any experience, you know that your doctor, usually the first thing they recommend or prescribe is a low-dose diuretic or something like that to help release some of the extra fluid you might be carrying in your body that's contributing to the high blood pressure. So the interesting thing is that when people come to see me and they say, I have high blood pressure, I say, let's rephrase it a bit. Let's say my blood pressure reading is high sometimes. Because like I said, it always fluctuates, it is always changing. So if you have high blood pressure and you're currently taking medication, regular exercise in the prescribed amounts and the prescribed intensities can actually be of great benefit to lowering that pressure so that you can either maybe maintain the dose of medication that you're taking, or so that you could eventually come off that medication if that's what your goal is. If it's in the early stages and you adopt some lifestyle changes and some exercise habits early, you may be able to prevent going on medication at all. So it's kind of a combination of knowing what you need to do to get your body into kind of a homeostasis with it, and then what steps you can take to ensuring that the blood pressure can come down naturally on its own. So what happens is when we begin the activity of actually moving and exercising, that systolic pressure increases temporarily because you've got more pressure as the blood pumps and hits those artery walls, right? And then when we get back to a resting heart rate and a resting position and a resting respiratory rate, the blood pressure or the blood vessels can then dilate and the blood pressure can fall. So what happens is we'll take a reading in the middle of exercise to make sure it's not going too high, and then at the end we'll see if we can slowly over time and incrementally get that baseline that you came in with a little bit lower, a little bit lower, a little bit lower. So that's kind of just one of the things I'll do in some of the sessions with clients that have high blood pressure, because it's really empowering sometimes for them to know that they can have this effect, this visceral physiological effect on something that otherwise might seem a little bit scary and a little bit frightening. So of course, always take your doctor's suggestions and recommendations, but tie in with that healthy lifestyle practices that can help complement and augment what it is that you're doing. So anyway, that's my quick little talk about high blood pressure, because it just answers a lot of questions that I get, and I hope you guys are doing well. Anything you can do to decrease stress in your life is going to go a long way to decreasing that blood pressure naturally. And if you have any questions, just reach out. Have a good one.